So telemedicine refers to the act of decentralizing or digitalizing clinical activities. Could be consultations with your GP or specialized personnel at the hospital. Anything that we can take out of the hospital unit and either move into the digital sphere or your own home. What we're talking about in terms of the future of telehealth and telemedicine, it doesn't need to be some distant utopia where we have flying cars and everything is based on technological magic. In many cases or in many hospitals, especially the more advanced settings, there is actually already quite a big approach towards this awareness.
Welcome to the Sustainable Healthcare Podcast, a podcast where we talk about sustainability in pharma, medtech, and healthcare services with tips and tricks on how you can get there. Today I am speaking with Lasse, one of our senior consultants, on telemedicine and how moving care and clinical treatment out of the hospital can have major sustainability benefits. It's definitely a megatrend in the healthcare industry, but I think it's often overlooked how this also plays into sustainability. So enjoy the episode. Lasse, welcome back to the Sustainable Healthcare Podcast. You are a senior consultant here with us at Green Innovation Group, and amongst other things, you have worked with the sustainability potential in telemedicine, and that is going to be the theme for this brief episode, Telemedicine 101 and the sustainability potential. Welcome.
Thanks for having me.
Yeah.
Pleasure to be here.
What is telemedicine?
So telemedicine refers to the act of decentralizing or digitalizing clinical activities. Could be consultations with your GP or specialized personnel at the hospital. Anything that we can take out of the hospital unit and either move into the digital sphere or your own home.
Yeah, the whole reason why we're having the Sustainable Healthcare Podcast is that we simply, as a human species, we cannot reach the green transition without getting the healthcare industry on board and making that industry sustainable. How does telemedicine help with that, or can help with that?
So as you say, there's an enormous potential here, most of all for sustainability reasons. Depending on how you look at it, around 80% of all of the current consultations with the GP in the Western world don't have a technical or medical need associated. There's no actual reason or technical reason why the doctor should be there talking to you in person.
Wow, 80%?
Around 80%, upwards of 80%. Some places it's upwards of 90%. And in those cases, if we imagine that we might take 80 to 90% of all GP consultations and make them digital, we know that each consultation that is made digital has a factor of around 100 in terms of environmental footprint savings compared to if that consultation would take place at a hospital or a clinic. So we are looking at absolutely massive savings. 80 to 90% of all consultations can be digital, technically can be digital, and they would save a factor of 100 in terms of the environmental footprint.
As I recall, a lot of that is stemming from the transportation, of course, but also from the need for additional building mass and so on.
Definitely.
So it's not really needed often. Actually, it's the exception that we need to go somewhere physically, and when we don't go there physically, we save a lot of CO2.
It sounds simple, but it is a relatively complex topic once you start diving in, as in many cases. As a medical anthropologist, I am acutely aware that, of course, the GP performs several actions that are, or functions that are not specifically related to the technical aspect of the consultation. So there might be a social-cultural or psychological aspect of going to the GP. And I think what we need to do if we want to approach a healthcare system that properly integrates telehealth and telemedicine, I think we need to look at what functions are served by the technical medical intervention, and then see how can we deliver that efficiently and hopefully digitally or decentralized and what aspects are purely social, cultural, psychological, and how do we support, for example, elderly people who need the personal support in a way that is also then efficient and doesn't kind of mingle the two aspects together.
Yeah, I guess that makes a lot of sense. That's one of the big question marks, that there are all these positive effects from speaking to a human being, which you deem have authority in an office, that are hard to really pin down, but that nonetheless that we can see are there.
I think just to paint a bit of the picture, what we're talking about in terms of the future of telehealth and telemedicine, it doesn't need to be some distant utopia where we have flying cars and everything is based on technological magic. In many cases, or in many hospitals, especially the more advanced settings, there is actually already quite a big approach towards this awareness, but for other reasons, for cost savings, for the use of efficiency. I recently learned that one specific department at the largest hospital the central hospital in Copenhagen, Denmark, they service around 1 million patient contacts per year with only 26 beds. And so they are actually well adapted and have been for years doing what we call circularity by accident. They have been accidentally trying to outsource and manage the patients at home or through other means very efficiently and to great success without it having the environmental agenda behind it. So what we need to do is to take those learnings from those practices and spread them out and use it as an active driver and motivation in other aspects of the care and the clinical system.
Could you try and paint a picture of what one type of consultation or treatment would look like today, and how that could look with the addition of telemedicine, not necessarily like in a completely telemedicine way, but where it's more integrated?
Yeah, I mean, of course there are many versions of this because it's a complex system, but to give an example, let's say you have an ongoing treatment and running consultations maybe every 6 months with a specialized department at the endocrine system of a certain hospital. And you need to have these touch points every 6 months or every 12 months. Currently, this is a relatively lengthy process where your appointment needs to be scheduled far ahead. And the organization for you to come to the hospital, especially if you live far away, is a relatively big operation for you to go to the specialized division and meet the doctors there and take the test and whatever you need. And if we had a more integrated telehealth approach, we would be able to look at that visit and say which aspects of this interaction can be technically managed, maybe at a smaller clinic, decentralized closer to where you live, like taking the blood samples and whatever you might need. And then what aspects are about you having contact with a doctor? Can we do that through a digital consultation that is then has a much more flexible scheduling? We don't need the clinical setting, we don't need the full operation of the hospital at a certain time, and we don't need the transportation most of all to bring people back and forth in both cases. So we could take a relatively mundane consultation but with a specialized division and make that accessible to people who might be living far away or have a difficult scheduling.
Yeah, and that's a good point of course as well, that telemedicine is a mega trend for a host of different reasons than sustainability, in terms of delivering care to rural areas and cost reductions and preventive healthcare and all of these things. And we are sort of trying to sneak sustainability in the back door, finding that it was often already there, but the potential is not really being acknowledged, and I think this figure you mentioned before, as I recall, is around a bit over 80 kilos of CO2 equivalents to go to a hospital, and less than 1 So around 100, you say, for teleconsultations from one of the studies that we're using, and that's just massive.
Just want to highlight one topic that usually stems out when we talk about the integration of telehealth and telemedicine. I think a topic that is quite interesting in this respect is the aspect of what we call decentralized monitoring. More simply, it's the use of devices to take measure of different biomarkers that are relevant for your treatment. And currently in the system, we don't, at least in many countries, there's not a full integration between the care provided by your specialized division at the hospital and then the devices that are actually available on the market to measure specific biomarkers to support that treatment. So I think by integrating wearable devices, we have a chance to really push the telehealth radically forward and with many benefits, not only environmental, of course.
In terms of sustainability, are we then adding a new dedicated device, or are we using a bring your own device, which is thankfully also a trend that is coming. And the key here, of course, is the data, and how can it be anonymized, and should we not provide health and care through some megatech company through Android or their iPhone at the same time from a sustainability angle, which is our focus. Creating a new dedicated device, so you'll end up having 7 different devices if you're a multi-disease patient. Then the telemedicine stops making sense from a sustainability perspective. So, what are your thoughts on some of these conundrums?
It's super interesting, and the question of data and how we treat it is definitely something that we need to address. The way I see it, we're looking into innovation in 2 different avenues, I would say. One is in terms of mostly private companies developing new solutions, either digital service solutions or devices or systems for managing those different data types. It is my firm belief that innovation in that avenue will come by itself. We know, or McKinsey Consulting has estimated that, at least in the States, the business opportunities for telehealth in the coming years is around $250 billion. So we're looking at a radical increase from what it was estimated of just a few years ago before the pandemic. So this constitutes now a huge sector, a potential sector boom. So I think the innovation will come from simply the market incentives to develop new solutions, and that's great. On the other hand, we need the support of public and semi-public actors to develop and innovate new legal frameworks for how to utilize, anonymize, and share that data. And we're seeing some efforts in some public collaborations, but we need to see those 2 avenues of innovation, the legal and the private device solution space, be integrated through public-private collaboration. I think that's where the real progress is going to be made.
Yeah, and that's always a difficult one, but it's both beautiful and sometimes frustrating with the healthcare sector that it's made up of collaborations, that no one is doing anything by themselves really, because the clinical testing and development of drugs and devices is always happening together with the hospital and so on, which is quite a different world from a lot of other industries, but of course also sometimes slows things down. Another really interesting sustainability angle, an area with telemedicine, is the potential for preventive healthcare. And we have a saying at Green Innovation Group that the best surgery you can do is the one you never have to do. Definitely the most sustainable one, or the best treatment is the one you never have to do, because you caught it before in the beginning. How does telemedicine enable preventive healthcare?
I mean, I think in several ways, if we lower the barrier to entry, let's say, into the consultation and make it easier for people to access the healthcare through different digital or decentralized means, I think the fact that we will have earlier touch points with the system and with the healthcare system will allow us to catch illnesses and issues early in the process, which is, we all know that it's a great idea, not only for, it's also for health reasons. It's better the earlier you catch these things. And I think, and this is another point where we see the bridge to the devices and the wearables playing a big part. If we really want to take leaps instead of steps in terms of preventive care, I think integrating the use of devices and finding out which, for example, you as a person, which biomarkers would be relevant for us to measure for you, and for that to happen relatively automatically through a device that integrates several types of data. I think that allows us to catch these things up front. So I think devices and wearables have a big potential in terms of preventive care.
Yeah, definitely. And so much treatment is still quite start-stop on the go. And then there's very little continuity throughout the day.
And we're used to mostly thinking about things when they arise as an issue that we need to take care of, right? Like, so this also speaks to the transition from sick care to actual preventive care and to healthcare.
Lasse, so if you had to sum it up, what is the sustainability potential in telemedicine?
Well, I don't have a number for you, but I can tell you that it is quite grand. Just looking at consultations alone, we know that again, we could probably see an 80% decrease in the actual physical meetings and consultations that need to take place. Each of those reducing the environmental footprint of that activity by upwards of 90%. So we have a big potential here as a society, and that's only talking about the environmental benefits. We also know that integration of telemedicine allows us to move towards preventive care, to increase access to care for marginalized groups, and so on. It has a lot of benefits down the line.
Yeah, thanks for sharing. And then there are, of course, pitfalls in how you actually fold it out, and how do we avoid too many new devices, and what are some of the hidden benefits of physical presence that we will do another deep dive later on. Thank you so much for coming, and and I'm really happy and excited that we've had the fortune to do some projects around telemedicine with clients as well. And
it's an exciting field.
It is. Have a great day, Lasse.
You too.
Thank you so much for listening to the episode. I really can't say that enough. We are getting more and more listeners, and I do appreciate every single one of you. We also are just sending out a lot of stuff through our newsletters and the podcast, and I would love to hear any feedback. So if you're sitting out there, please either write to me on LinkedIn or give us a review. Any feedback is highly appreciated. Thank you for listening to the episode, and enjoy your day.